Clindamycin 75 mg per 5 ml oral solution systemic is a type of antibiotic medication that is used to treat a wide range of serious bacterial infections. It works by stopping the growth of bacteria in the body. It's important to note that this medication only treats bacterial infections and will not work for viral infections such as the common cold or flu. It's crucial to only use this medication as directed by your healthcare provider and to avoid unnecessary use or overuse, as this can lead to decreased effectiveness. The daily dosage and optimal timing for taking this medication will be determined by your doctor based on your specific condition and medical history. Be sure to follow their instructions carefully for the best results. When taking clindamycin 75 mg per 5 ml oral solution systemic, it's important to shake the bottle well before each dose. Be sure to measure the dose accurately using a special measuring device or spoon, not a household spoon. You can take this medication by mouth with or without food, as directed by your doctor, usually 3 or 4 times a day. For the best results, take this antibiotic at evenly spaced times. Try to take it at the same time every day to help you remember. It's important to continue taking this medication until the full prescribed amount is finished, even if your symptoms improve after a few days. Stopping the medication too early may cause the infection to return. If your condition lasts or gets worse, be sure to inform your doctor. Some common side effects of clindamycin 75 mg per 5 ml oral solution systemic include nausea, vomiting, upset stomach, or mild diarrhea. If these effects persist or worsen, it is important to notify your doctor or pharmacist. It's essential to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, it is important to tell your doctor right away if you experience any serious side effects, such as sore or painful throat, joint pain or swelling, yellowing of the eyes or skin, or signs of kidney problems like a change in the amount of urine. Long-term or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. If you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms, it is important to contact your doctor. While a serious allergic reaction to this drug is rare, it is crucial to seek medical attention immediately if you experience symptoms such as fever that doesn't go away, new or worsening lymph node swelling, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. Remember to always consult your doctor for medical advice about side effects. If you experience symptoms such as diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to inform your doctor immediately. Avoid using anti-diarrhea or opioid products as they may worsen the symptoms. Instead, consult your doctor or pharmacist for advice on an appropriate treatment plan. It's crucial to seek medical attention if you notice these symptoms, as they could indicate a rare but severe intestinal condition caused by a bacteria called C. difficile, which may occur during treatment or even weeks to months after treatment has ended. Before taking clindamycin, it's important to let your doctor or pharmacist know about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have liver or kidney disease, intestinal diseases, chronic asthma, or hay fever. Clindamycin may also affect the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional if you are using clindamycin before receiving any immunizations or vaccinations. Before having surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to let your doctor know if you are pregnant or breastfeeding before using this medication, as it may pass into breast milk. Older adults may also be more sensitive to the side effects of this drug, particularly diarrhea. When taking clindamycin 75 mg per 5 ml oral solution systemic, it's important to be aware of potential drug interactions. These interactions could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with clindamycin 75 mg per 5 ml oral solution systemic is clindamycin. Be sure to discuss any concerns or questions about potential drug interactions with your healthcare provider. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, they should seek immediate medical attention. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important not to share this medication with others, as it has been prescribed specifically for your current condition. Do not hold on to this medication for future use unless instructed by your doctor. If you are taking this medication for an extended period of time, your doctor may recommend laboratory or medical tests to monitor your kidney and liver function, as well as your blood counts. Be sure to consult with your doctor for more information on this. If you forget to take a dose of clindamycin 75 mg per 5 ml oral solution systemic, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When using clindamycin 75 mg per 5 ml oral solution systemic, make sure to follow the instructions on whether to refrigerate the medication or keep it at room temperature. Also, pay attention to the expiration date and discard the bottle when it is no longer needed. It is important to keep all medications away from children and pets to avoid any accidents. And remember, do not flush medications down the toilet or pour them into a drain unless instructed to do so. If you have any questions about how to properly dispose of this medication, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.